7 signs of mini-strokes in elderly transient ischemic attack. Mini-strokes, or transient ischemic attacks, TIAs, are crucial warning signs that could indicate the risk of a severe stroke in the future. Recognizing the symptoms of a TIA can make a life-saving difference, especially for elderly individuals who are more prone to these events. Today, we'll guide you through the 7 key signs of a mini-stroke, explain why they matter, and share actionable steps to respond and reduce the risks of future strokes. Let's dive in. A transient ischemic attack happens when blood flow to the brain is temporarily disrupted. This blockage is usually brief, lasting from a few minutes to an hour, and resolves on its own without causing permanent damage. However, TIAs should never be taken lightly. Consider them as the red flag or warning bell that a larger, more severe stroke could be waiting to occur. Unlike heart issues that may develop silently over the years, mini-strokes come with sudden, recognizable symptoms. Identifying these symptoms early can increase the chances of preventing a major stroke, which is why understanding them is critical for all elderly individuals and their caregivers. You may wonder why mini-strokes require so much attention if their symptoms fade quickly. Here's why. TIAs share almost all the same symptoms as a stroke, and the only difference is that the symptoms are temporary. However, statistics show that individuals who experience a TIA have a significantly higher risk of suffering from a full stroke later. Acting on these warning signs may reduce long-term complications, prevent fatalities, and improve overall health. Also, it's worth noting that many elderly individuals dismiss mini-stroke symptoms as something minor, like fatigue, stress, or a lightheaded moment. But ignoring these signs even once could cost you or your loved one dearly. Now, let's get into the 7 warning signs of mini-strokes. One of the most common signs of a mini-stroke is sudden numbness or weakness in the body. This typically happens on one side, affecting the face, arm, or leg, but it can occur anywhere. You might find that you suddenly can't grip objects or that your legs feel unusually heavy. Such weakness appears abruptly and should never be ignored, even if you regain feeling after a few seconds or minutes. It's a red flag that blood flow may have temporarily stopped reaching certain parts of your brain. The second key sign is problems with speech or comprehension. During a TIA, some people may experience slurred speech, making it difficult for others to understand them. You might also find it difficult to articulate words or sentences properly, as if your brain and mouth aren't syncing. Additionally, some individuals may struggle to process what others are saying. Conversations that seemed clear one moment may suddenly feel confusing. Don't assume this symptom is a passing moment of being distracted. Seek help immediately. TIAs can also present as sudden problems with eyesight, affecting one or both eyes. You might experience blurred vision, double vision, partial vision loss, or complete blindness in one eye. This inability to see clearly can be disorienting and dangerous, especially if it happens while you're driving or walking. Remember, even if vision returns to normal after a few minutes, this is not a symptom to ignore. Sudden changes in sight could indicate a temporary blockage of blood flow in the parts of the brain that handle vision. Sometimes, a mini-stroke causes sudden dizziness or a feeling of being off balance. You might find yourself unable to stand upright or feel unsteady when walking. This can also be accompanied by a sense of vertigo, where the room feels like it's spinning. If you feel disoriented or like you're about to fall for no apparent reason, it's crucial to seek help. Loss of coordination or balance is commonly associated with blockages in the brain, even if it resolves quickly. A sudden onset of confusion or a foggy feeling in the mind can also be a warning sign of a TI. You may find it hard to think clearly, make decisions, or recall simple details. Completing basic tasks could feel overwhelming, as if you're disconnected from reality. This type of mental fog should be taken as seriously as physical symptoms. Many people attribute such confusion to aging, but in the context of a mini-stroke, it's a sign of disrupted brain activity. A mini-stroke may also cause a sudden and intense headache, often described as one of the worst you've ever felt. The headache is not linked to usual triggers, such as stress or dehydration, and appears without warning. Severe headaches during a TIA should be treated as potential medical emergencies. They could indicate changes in blood flow to the brain, even if they disappear after a short while. Finally, facial drooping is another symptom to watch for. You may notice one side of your face sagging or feel that your smile appears uneven when you look in the mirror. This occurs because the nerves controlling facial muscles are affected by the temporary lack of blood flow. If you or someone else experiences facial sagging or drooping, don't delay in seeking medical attention, even if it resolves on its own. Recognizing these warning signs is only half the battle. Knowing how to respond promptly is equally vital. Every second counts when it comes to suspected strokes or TIAs. Here's what to do. Use the Be Fast method. This mnemonic helps identify symptoms and act quickly. B. Balance. Is there sudden loss of balance or coordination? E. Eyes. Is there sudden blurred or lost vision? F. Face. Does one side of the face droop? A. Arms. Is there weakness or numbness in one arm? S. Speech. Is speech slurred or hard to understand? T. Time. Time is critical. Call 911 or your local emergency services immediately. Do not attempt to drive yourself or delay calling for help because symptoms seem to have resolved. Remember that mini strokes are a medical emergency. Share all symptoms with emergency responders and your healthcare provider to ensure proper evaluation. One common issue is dismissing mini stroke symptoms. Many people, particularly in older age, may attribute these sudden events to fatigue, dehydration, or just getting older. However, TIAs are not a normal part of aging. They're serious indications of underlying health risks, particularly stroke. Ignoring these signs can lead to devastating consequences, including potentially life-threatening strokes or severe disabilities. Always err on the side of caution and consult a healthcare provider for an evaluation after any suspected TI. Certain conditions increase the likelihood of TIAs. These include high blood pressure, diabetes, smoking, high cholesterol, sedentary lifestyles, being overweight or obese, family history of strokes. By understanding these risk factors, individuals and caregivers can work proactively with healthcare providers to manage underlying conditions and lower the risk. Taking charge of your health is one of the best ways to prevent TIAs and future strokes. Some prevention tips include following a heart-healthy diet, like the Mediterranean diet, which is rich in fruits, vegetables, and whole grains. Staying active with regular physical activity tailored to your mobility level. Quitting smoking and avoiding exposure to secondhand smoke. Managing medical conditions like hypertension, diabetes, and high cholesterol with your doctor's guidance. Taking medications as prescribed, including blood thinners if recommended. Preventive care saves lives, so staying vigilant about your health is key. If you or a loved one experiences a mini stroke, it's essential to follow up with your healthcare provider for further testing and treatment. Doctors might recommend imaging tests, such as an MRI or CT scan, to assess the condition of your blood vessels and brain. Medications to reduce future stroke risk may also be prescribed. Commit to a personalized stroke prevention plan and ensure you attend all follow-up appointments. Mini strokes are serious, life-changing events that deserve your full attention. By learning the 7 key warning signs, numbness, speech difficulties, vision changes, dizziness, confusion, severe headaches, and facial drooping, you're equipped to act decisively in protecting yourself or a loved one. Remember, even if symptoms disappear, don't ignore them. TIAs are a chance to take proactive action and reduce your risk of a major stroke. Together, let's strive for health and well-being in our later years, ensuring quality of life through awareness and timely care. Stay informed, stay vigilant, and stay safe.